Welcome to the deep dive. Today we're getting into something lots of animal owners, especially those with puppies or kittens, might worry about: Colibacillosis.
That's right. It's all about E. coli, a bacterium that's usually, just a normal part of the gut flora.
But sometimes it causes some serious problems, yeah.
Exactly. And that's what we're diving into. We've looked at some veterinary texts to pull out the really key info for you.
So the mission is to make sense of Colibacillosis, understand when this common bacteria becomes, well, uncommon in its effects.
Precisely. To give you the crucial details without getting bogged down in overly technical jargon, it's a fascinating balance, this bug being both a resident and a potential pathogen.
Okay, let's start with the basics. E.
Okay.
coli. It's everywhere. So what is Colibacillosis exactly? When does E. coli cross the line?
Well, colibacillosis is basically an acute infection. We see it most often and most seriously in very young animals. Think puppies and kittens, usually in their first week.
The really vulnerable state.
Absolutely. And it's caused by specific types of E. coli that manage to cause disease. And interestingly, it can also make other bad things, like parvovirus infections, even worse.
So if E. coli is normally in the gut, how do you tell if it's causing the problem or just hanging out?
Yeah, that's a critical point. Just finding E. coli in, say, a stool sample doesn't automatically mean colibacillosis. It's expected there.
Right.
The real indicator is finding it where it shouldn't be. So isolating it from the bloodstream or from internal organs during an examination or necropsy, that's strong evidence of an invasive infection.
Okay, so it's about invasion, systemic spread.
Pretty much. Especially in those neonates, it often becomes septicemia infection throughout the whole body. And while it's classic in newborns, older animals can get E. coli infections too, though maybe different strains and less clear triggers sometimes.
Got it. So what actually makes these E. coli turn bad? What's the mechanism? Do they have special weapons or something?
They do. We call them virulence factors. It's pretty complex, and honestly, we're still figuring out all the details. But in newborns, it seems like a combination of things. Their immune systems aren't fully developed yet, their gut lining, the barrier, it's immature.
So an opportunity for the bacteria.
Exactly. The E. coli that are already there can sometimes take advantage. We know some specific types are culprits in dogs. You might see acronyms like ETEC, AEC, UPEC, CNF plus Syncosi. Cats have similar troublemakers, just maybe less characterized.
ETEC, AEC. Okay, what do those actually do? Can we break that down a bit?
Sure. Let's take ETEC, that stands for enterotoxigenic E. coli. These guys have adhesins, think of them like little grappling hooks, to stick onto the intestinal lining.
Okay.
And once they're stuck, they pump out enterotoxins, like one called ESCA. These toxins basically tell the gut cells to secrete loads of fluid.
Leading to diarrhea. Makes sense.
Right. Then you have AEEC, attaching and effacing E. coli. These are maybe even sneakier. They use something called an attaching and effacing factor, or EAE.
Attaching and effacing sounds destructive.
It is. They lash on super tightly, and then they actually efface or wipe away the microvilli, those tiny absorptive structures on the gut cells. So they're not just sticking, they're damaging the absorption machinery.
Wow. Okay.
Yeah.
And you mentioned something about red blood cells.
Yeah, many of these pathogenic E. coli in dogs and cats are hemolytic. They produce substances that break down red blood cells that can definitely make the animal sicker.
And there was something specific about boxer dogs. That sounded really interesting.
Yes, that's a very specific situation. Researchers found a particular type of E. coli linked to a serious form of inflammatory bowel disease in Bacter's granulomatous colitis.
What's unique about that one?
This E. coli doesn't just stick to the outside, it actually invades and lives inside macrophages.
Immune cells. But aren't macrophages supposed to kill bacteria?
Normally, yes. But this strain can survive and replicate within them. It's like hiding inside the guardhouse. And by doing that, it triggers massive chronic inflammation in the colon wall. Really nasty.
A Trojan horse, basically. That's fascinating. So thinking about the whole animal, which body systems usually get hit hardest by colibacillosis?
In those very young neonates, it's primarily the small intestine causing enteritis, inflammation, and then because it so often goes systemic, the whole body through septicemia.
Okay.
In older puppies, kittens, and adults, you still see the enteritis, but E. coli is versatile. It's a major cause of urinary tract issue cystitis, which is bladder infection, kidney infections, pyelonephritis, even uterine infections, endometritis, or prostate infections.
So urinary tract is a big one too.
Definitely. And also mammary glands mastitis, and as we saw with the boxers, the large intestine causing colitis.
And just to confirm, that boxer connection points to a genetic element, right?
Yeah, the evidence really points that way. Boxers seem to have some kind of inherent susceptibility to that specific E. coli-driven colitis.
How common is this overall? Do we have numbers on incidences?
Precise stats are tricky. It's
Yeah.
not always specifically tested for or reported consistently, but we know it's definitely most common in those neonatal puppies and kittens under a week old.
Especially if they didn't get enough colostrum.
Exactly. That first milk is crucial for antibodies. It's also more frequent in crowded places, kennels, catteries where hygiene might be challenged.
In older animals.
Sporadic cases, often diarrhea or those urogenital infections we mentioned. But E. coli also gets blamed for some other things sometimes, like skin infections with pus, ear infections, even occasionally serious neurological stuff like meningoencephalomyelitis.
Wow, it really can pop up in different places. What about specific findings? Differences between dogs and cats?
Well, for dogs with diarrhea, studies have found E-tech strains in, say, roughly 3% up to nearly 30% of cases, depending on the study. These often produce those STT toxins, maybe STB, have that CNF plus marker, and are often hemolytic. And for newborn puppy septicemia, E. coli is a huge player, often a type called beta hemolytic, which is particularly aggressive. Puppies can get exposed in utero, during birth, or from mom's milk if she has mastitis.
And cats. Similar story or different players?
Similar themes, maybe slightly different E. coli types emphasized in research. For cat diarrhea, EPEC strains are often implicated, those attaching and effacing ones, usually EAE plus in hemolytic. There's also extraintestinal pathogenic E. coli linked to nasty pneumonia or chest infections in cats. These often have a factor called CNF1 and other sticky molecules.
And urinary infections in cats.
Yep, UPEC, uropathogenic E. coli. Often they have CNF1 special fimbriae or hairs called P. fimbriae to help them stick in the urinary tract, and again, often hemolytic. These details on strains help veterinarians understand the likely disease patterns.
It definitely paints a clearer picture. Is this a problem everywhere, or are there geographic hotspots? And besides neonates and boxers, any other groups especially at risk?
Nah, it's pretty much worldwide. Dogs and cats everywhere can be affected. We keep coming back to boxers for that specific colitis, and newborns, under 2 weeks usually, are the prime target for that severe diarrheal and septicemic form.
And older animals?
More random occurrences, often tied to something else weakening them, like another illness.
Okay, so let's talk signs. If you suspect colibacillosis, particularly in a young litter, what are the red flags?
Well, given how bad it can be systemically in the little ones, the signs can hit fast and hard. You might see really sudden vomiting, lethargy, just no energy, weakness, diarrhea, and they might feel cold.
Cold skin.
Yeah, hypothermia is common. And often, sadly, you'll see multiple pups or kittens in the litter affected around the same time.
And in an older animal? Maybe less dramatic?
Can be, often just vomiting and diarrhea, maybe seeming a bit off.
What would a vet look for on examination?
In those neonates, they'd likely see profound depression, no appetite, the vomiting, maybe a really fast heart rate initially, weakness, that low temperature, maybe a bluish tinge to the gums, cyanosis, meaning poor oxygen, and definitely watery diarrhea.
Sounds critical.
It is. In older animals, maybe with that E-tech diarrhea, they might find signs of dehydration, sunken eyes, tacky gums, along with the vomiting and diarrhea, and sometimes a fever.
Right. Let's circle back to causes and risks. E. coli is normal flora. So what tips the scale towards disease?
Good question. Remember, E. coli is supposed to be there in the gut on the perineal skin in healthy adults. Figuring out if a specific isolate is actually pathogenic often needs those molecular tests for virulence factors.
Because not all E. coli are created equal.
Exactly. And in older animals, E. coli infections often seem to be opportunistic. Like, they happen when something else is already wrong.
Like another infection.
Yeah, or other stressors.
Okay, so for the newborns, what are the biggest risk factors? Things breeders or rescues need to watch.
This is key for prevention. Poor health or nutrition in the mother during pregnancy is a big one. Affects puppy-kitten vitality and colostrum quality.
And the colostrum itself.
Huge. Not getting enough of that antibody-rich first milk leaves them incredibly vulnerable. A dirty whelping or queening box is another risk. Difficult births, dystocia, and overcrowding, which just makes it easier for bacteria to spread.
Makes sense. What about risks for older animals getting E. coli issues?
Things like having another concurrent disease, parvo is a classic example, or heavy parasite loads. Sometimes antibiotic use can disrupt the normal gut flora, allowing bad E. coli to overgrow.
Oh, ironically.
Yeah, anything causing immunosuppression, mastitis in a mother after birth, Even things like having an IV catheter in place can be a potential entry point for bacteria leading to septicemia.
So diagnosis seems critical, but also tricky. How do vets confirm it's Colibacillosis and not something else?
Confirmation really relies on bacterial culture. Ideally, blood culture from a live, sick animal, or if it's a postmortem, cultures from places like bone marrow, heart blood, liver, spleen, places bacteria shouldn't normally be.
And you mentioned avoiding antibiotics before sampling.
Crucial. Antibiotics can kill the bacteria or stop them from growing in culture, giving you a false negative. And for those specific types like E-tech, you need the specialized DNA or PCR tests to look for the toxin and adhesin genes. Just growing E. coli isn't enough in those cases.
And there must be a lot of other things that can look like this.
Oh, absolutely. The list of differentials, especially for something like enteritis or diarrhea, is massive. Other infections, viruses, bacteria, parasites, dietary issues, sudden food changes, eating garbage, toxins, certain drugs, problems with other organs like the pancreas or kidneys that cause gut signs, blockages, neurological issues. And for fading neonates, there's a whole separate list of possibilities. Diagnosis isn't always straightforward.
Given how serious it could be, especially for the young ones, what's the treatment plan usually look like?
For those acutely ill puppies and kittens, it's all about intensive care. They need to be hospitalized. Supportive care is number one. Follow IV fluids, balanced ones, to correct dehydration and electrolyte imbalances. Oral glucose if they have that really watery secretory diarrhea.
Keeping them warm too, I imagine.
Definitely. Good nursing care is vital, keeping them warm, clean. If they're septicemic, keeping them quiet, limiting activity. If they're supposed to be nursing but are too weak, they might need bottle feeding or even IV nutrition. We have to be honest, though neonatal colobacillosis is life-threatening, the prognosis is often guarded, even with intensive care.
What about antibiotics? Are they always used?
For septicemia, yes, antibiotics are essential. The best approach is to base the choice on culture and sensitivity results, finding out exactly which drug kills that specific bacteria.
But that takes time, right?
It does. So vets usually start treatment immediately with an empiric choice, an antibiotic that's generally effective against common E. coli strains found in these situations while waiting for the lab results.
Any specific drugs commonly used?
Yeah, drugs like amikacin, some cephalosporins like cefazolin or sfoxetin, sometimes fluoroquinolones like enrofloxacin or ticarcillin combined with clavulanate are often considered. Dosages vary between dogs and cats.
You mentioned enrofloxacin. Any caveats there?
Big one. Enrofloxacin and other fluoroquinolones shouldn't be used in young, growing animals or pregnant ones because they can damage developing cartilage. Very important contraindication.
Good to know. Are there antibiotics that don't work well?
Generally, things like chloramphenicol or trimethoprim sulfa combos are often considered less reliable for serious E. coli septicemia. Susceptibility can vary, though.
Okay, so treatment is intensive. What about prevention? Can breeders and owners do things to stop it from happening?
Absolutely. And prevention is always better. It really comes down to good husbandry. Start with the mother, good health, good nutrition during pregnancy, make sure she's appropriately vaccinated.
And the birthing environment.
Critically important. Keep it clean, hygienic, change bedding frequently. And, we keep saying it because it's so vital, ensure every single newborn gets enough colostrum, ideally within the first few hours.
What else?
Keep the mother and litter separate from other animals, especially if there's any illness around. Avoid overcrowding. And basic biosecurity, wash hands thoroughly before and after handling newborns. Maybe even change clothes or shoes if you've been in other animal areas. Simple things can make a big difference.
So looking at the whole picture, what's the expected course and the prognosis again?
For neonates, as we said, it can be incredibly fast and often has a poor prognosis. Rapid, aggressive, supportive care gives them the best chance, but it's a tough battle.
And for older animals?
It depends. If it's, say, uncomplicated E-tech diarrhea in an adult with supportive care to manage dehydration, they might recover well. It can sometimes be self-limiting. But if it's severe or involves the urinary tract deeply, or if there are underlying health problems, the course and prognosis will vary.
This has been really comprehensive. If you had to boil it down, what are the absolute key takeaways for listeners?
I'd say 1. E. coli is common, usually harmless, but certain strains can cause severe disease, especially in the very young. 2. Recognizing risk factors, poor colostrum intake, hygiene issues is crucial for prevention. 3. Early signs in neonates need immediate veterinary attention. 4. Diagnosis involves more than just finding E. coli. It's about where it's found and what type it might be. And 5. The complexity, like that boxer situation, shows there's still more to learn.
That's a great summary. It really highlights the importance of vigilance and good care. Which leads us to a final thought for you, our listener. Knowing that E. coli is basically everywhere, what's one small, practical thing you could change or be more mindful of in your interactions with animals, particularly young ones, to help minimize their risk based on everything we've talked about today? Something to chew on.
Thank you for joining us for this deep dive into colibacillosis. Hopefully it's given you some valuable perspective.
Yes, thanks so much for tuning in to the deep dive. Let us know if there are other topics you'd like us to tackle. Until next time, stay informed and take care.